calcineurin, a protein that plays a role in transcription of interleukin 2. Tacrolimus and cyclosporin are drug target calcineurin. Yeah.
The formula for loading dose of a drug is blank.
Loading dosage volume of distribution in target plasma concentration by bioavailability.
Desired plasma conc XVD divided by bioavailability. Amount equals conc V. Infusion rate of a drug is calculated by formula blank.
Infusion rate.
Clearance of the drug X steady state plasma concentration. CL equals excretion rate of drug divided by plasma concentration.
Clear excretion rate of drug by plasma excretion rate plasma concentration out of the clearance of drug distributed. Clearance of drug is clearance. Plasma concentration clearance of excretion rate of the drug to the excretion rate আছে drug excretion rate plasma concentration.
Maintenance dose is calculated as blank.
Maintenance dose.
Clearance of the drug X steady state plasma concentration X dosing interval divided by bioavailability. Maintenance dose equals excretion rate X dosing interval excretion rate equals CLX plasma concentration. Since the drug is taken orally, it has to be divided by bioavailability.
Maintenance dose. Clear of the drug to steady state concentration. Dosing interval by
T1 half of a drug is given by blank. 0.7 xvd cl. Volume of distribution is calculated as blank. Dose conc. Conc equals amount volume. Drugs following zero-order kinetics can be remembered using the mnemonic. Watt power blank alcohol, aspirin tolbutamide theophylline phenytoin.
Drugs following zero-order kinetics can be remembered using the mnemonic watt power. W for warfarin হবে আর কি, আর কোনো W দিয়ে ড্রাগ আছে? অ্যাসপিরিন, ওয়ারফারিন, অ্যাসপিরিন, অ্যালকোহল, টলবুটামাইড, থিওফাইলিন, ফেনিটয়েল, টলবুটামাইড, থিওফাইলিন, ফেনিটয়েল as drugs following zero order kinetics. Wait for warfarin, aspirin, warfarin, aspirin, tolbutamide, theophylline, phenytoin, aspirin, alcohol, তো warfarin
Warfarin.
তো
How much drug will remain at end of 6 hours when a patient is given 200 milligrams of drug? 75 milligrams is excreted in 90 minutes and the drug follows first order kinetics.
জানি না।
Blank. 30.5. First order kinetics. Constant fraction of drug is excreted in a given time. So 3/8 remains after 90 minutes. So after every 90 minutes, 3/8 of the drug is excreted. Better way 125 200ths equals 5/8, so 5/8 of 200 milligrams remains after 90 minimum 5/8 asterisk 5/8 asterisk 200 is after 180 minutes 5/8 caret 4 of 200 remains. If options not so close, estimate the T1 half so 75 is excreted in 90 minutes, so assume that 100 is excreted in 2 hours. So the T1 half is 2 hours. So after 6 hours, about 25 milligrams of drug should remain. The P450 enzyme involved in METAB of clopidogrel and omeprazole is blank.
2C19.
2 Cypriot pounds C19. Clopidogrel requires it to be converted to active form. Omeprazole inhibits it. So, clopidogrel should not be given with omeprazole.
Okay.
Slime drugs can be removed by dialysis. Blank lithium INH methanol ethylene glycol. The P450 enzyme involved in METAB of clopidogrel and omeprazole is blank.
The P450 involved in metabolism clopidogrel. omeprazole কি করবে? আচ্ছা, ক্লোপিডোগ্রেলের অ্যাক্টিভেট হওয়ার জন্য সাইটোক্রোম 2C19 যে এনজাইমটা আছে, মাইক্রোজোম এনজাইমটা, সেটার প্রয়োজন। এখন প্রবলেমটা হচ্ছে ওমিপ্রাজল কি করে এই যে এনজাইমটাকে সাইটোক্রোম 2C19 এনজাইমটাকে ডিঅ্যাক্টিভেট করে বা ব্লক করে, ঠিক আছে, ইনহিবিট করে। তো এটা হলে কি হবে যে ক্লোপিডোগ্রেল অ্যাক্টিভেটই হবে না। ঠিক আছে, রুবি রুল অ্যাক্টিভেট না হলে রুবি রুল ফেলিয়ার হবে। নাইস।
2 Cypriot pounds C19. Clopidogrel requires it to be converted to active form. Slime drugs can be removed by dialysis. Blank lithium
Slime.
INH methanol ethylene glycol.
পাইরোনোল্যাক্ট S4 কি আছে? লিথিয়াম আইসোনিয়াজিড, ইথানল, ইথাইল
Salicylates. The
স্যালিসাইড।
drugs which are plasma protein bound are not suitable for dialysis, e.g. diazepam, digoxin, verapamil.
ডায়াজিলম, ডিজক্সিন, ডিডিভি, ডিভিডি, ডায়াজিলম। Digoxin. Slime drugs can be removed by dialysis. Salicylate, lithium salicylates, lithium isolated, salicylates. Salicylates, lithium, ethanol, lithium glycol, deoxin.
Lipid-soluble drugs cannot cross BBB, but still can affect the vomiting center because the blank
It's outside BBB.
BBB is deficient at the chemoreceptor trigger zone. CTZ. Emesis center. To excrete barbiturates from the body, forced blank of urine is done.
Barbiturate, morphine,
Alkalinization. Barbiturates are weakly acidic. Thiopental, phenobarbitone, are weakly acidic. Ketones are acidic.
Baritone, pental, nucleic acidic, thiopentol, weakly acidic ketones are acidic.
Drugs causing lupus-like syndrome. Blank 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 blank. Sulfonamides, hydralazine, isoniazid, procainamide, phenytoin. Ship drugs. These drugs are metabolized by acetylation. Slow acetylators can see an up-pointing arrow level of these drugs.
NCN level of cheap drugs, sulfonamide, hydralazine, isoniazid, procainamide, or phenytoin, sulfonamide, hydralazine, isoniazid, sulfonamide, procainamide, sulfonamide, hydralazine, sulfonamide, hydralazine, isoniazid, sulfonamide, hydralazine, isoniazid, sulfonamide, hydralazine, isoniazid, sulfonamide, hydralazine, isoniazid, and procainamide or phenytoin, sulfonamide, hydralazine, isoniazid, procainamide or phenytoin. Sheep drug.
Blank, aka MDR1, is a member of ATP binding cassette transporter. which acts as an efflux membrane transporter and decreases the concentration of intracellular drugs.
EGP, MDR1, MDR1. So membrane member of ATP binding cassette transporter. ATP binding cassette transporter. That's a efflux membrane transporter.
P-glycoprotein.
अच्छा glycoprotein. MDR1 is member of ATP binding cassette transporter which acts as an efflux membrane transporter and decreases the concentration of intracellular drugs. Okay, and then next, then starting
Blank, aka MDR1.
take option reset parts. তুই ভাই না 20 বারের করি ভাই. How is dietary cholesterol sent to the liver? How is dietary cholesterol sent to the liver? Converted to cholesterol esters packaged in chylomicrons. কিভাবে ডায়েটারি কোলেস্টেরল আছে সেটা কিভাবে সেন্ড করা হয় লিভারে, কনভার্ট করা হয় কোলেস্টেরল এস্টারে, তারপর কাইলোমাইক্রনের মধ্যে প্যাকেজ করে পাঠানো হয়. Triglyceride. HMG co-reductive lovastatin, pravastatin, decrease LDL, decrease HDL, decrease triglyceride. Inhibit concentration of HMG coenzyme A2. Inhibit করে conversion of HMG coenzyme A2 mevalonate. করে conversion কি HMG? A cholesterol precursor, decrease mortality of coronary artery disease patient. Adverse effect hepatotoxicity increase elective myopathy, especially when used with fibrate as like niacin. গানে গানে সুরে সুরে কত কথা বলেছি তোমাকে, তুমি বোঝনি, বোঝনি. কখনো যদি আনমনে চেয়ে হঠাৎ এসে জড়িয়ে ধরো, জড়িয়ে ধরে বলো ভালোবাসো. না 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 না. কখনো যদি আনমনে চেয়ে হঠাৎ এসে যদি কেউ কথা না কয় ওরে ওরে ও বাঘা কেউ কথা না কয়, যদি সবাই থাকে মুখ ফিরায় সবাই করে ভয়, যদি সবাই থাকে মুখ ফিরায় সবাই করে ভয়, যদি তোর ডাক শুনে কেউ না আসে তবে একলা চলো রে, যদি তোর ডাক শুনে কেউ না আসে তবে একলা চলো রে, তবে একলা চলো, একলা চলো, একলা চলো, চলো একলা চলো রে, যদি তোর ডাক শুনে কেউ না আসে তবে একলা চলো রে। तुम्हारी मुशी है तू मेरे
Maintenance dose is calculated as blank. Volume of distribution is calculated as blank. Infusion rate of a drug is calculated by formula blank.
sodium nitrate.
Nicorandil is a K plus channel opener and MOA2 used in the management of angina. No releaser. Nicorandil tilde no releaser dil tilde heart tilde angina.
दिल होते जो मेरे सीने में दो, आखिरी दिल भी मैं तुम्हें दूँ तोड़ने को, तू तोड़ने को, तोड़ने को, तोड़ने को। दिलकश थी वो शाम पहले पहल जब कि तुमसे मिली थी नजर, ऐसा चक्कर आया कि अभी न जानूं कि जाऊं, मैं जाऊं किधर। जो
T1
तेरे
half of a drug is given by
नाम
blank.
तो तकदीर ऐसी
0.7 xvd cl. Fasudil is a blank inhibitor used in management of angina. Rho kinase. Rho kinase right pointing arrow vasospasm of coronary arteries. Rho kinase inhibitor right pointing arrow down pointing arrow vasospasm of coronary arteries. It is an academic drug, and is not. Which drugs can cause malignant hyperthermia? Succinylcholine volatile inhaled anesthetics. Blank is a K plus channel opener and NO releaser used in the management of angina. Nicorandil. Drugs following zero-order kinetics can be remembered using the mnemonic. Watt power blank alcohol, warfarin. Fasudil is a Rho kinase inhibitor activator used in management of angina. Inhibitor. Rho. How much drug will remain at end of 6 hours when a patient is given 200 milligrams of drug? 75. Mecasermin is an IGF-1 analog, used to treat growth hormone deficiency. Mecasermin is an IG analog. Nicorandil is AK plus channel opener and NO angina. Fasudil is a Rho kinase inhibitor used in management of blank. Angina. Rho kinase right-pointing arrow vasospasm of coronary arteries Rho, which NSAID should be avoided in the treatment of aspirin can decrease uric acid excretion at low doses. Therapeutic index of the following drug is blank. 4. TI equals LD50 ED. Slime drugs can be removed by dialysis. Blank lithium INH methanol salicylates. The drugs which are plasma protein bound are not suitable for dialysis, e.g. diazepam, digoxin, verapamil.